Welcome to today's local Black Hawk County Emergency Operations Center COVID-19 briefing. For the media who is joining us virtually through Zoom, this is an attempt to encourage social distancing, improve our reach, and better keep our media partners safe during the COVID-19 surge. Representatives from the media will be able to ask questions during our usual Q&A time. Media will be muted until that time. If you are using a computer link, you are asked to raise your hand to ask a question or type your question into the chat box. If you are on a phone line, please press *9 to raise your hand for a question. Thank you for your patience as we work through the kinks of this new format. My name is Lorie Glover, Black Hawk County Emergency Management Coordinator, and I will introduce Nafissa Cisse-Egbuonye, the Director of the Black Hawk County Public Health.
Good afternoon, everyone. I want to start off this afternoon in particular just thanking the community and all our members of the EOC. But I also want to specifically today thank the health department staff who have been working Monday through Sunday diligently to conduct the contacts tracing of the cases, and these are particular vulnerable populations, and so at times just some of the case investigations take a much longer time due to language barriers, due to just other things that situations. But so most important, I just want to tell them thank you for all they're doing. They're working Monday through Sunday to serve this community, and I'm just very proud to be part of this this incredible team of individuals who are just dedicated to serving the community. So thank you, staff. So I'll start off with our numbers today. Black Hawk County, we are reporting 622 reported cases, and a total of 7 deaths here. So we received 4 additional deaths since my last press conference. And again, my thoughts and prayers go out to the families. This is a very, very difficult time. So I want to continue to emphasize how important it is for people to stay at home. When you're staying at home and you're practicing social distancing, you're contributing in saving the lives of people that are really vulnerable to this disease. So please continue to practice social distancing, and please continue to stay at home, and stay at home with only your immediate family. Only leave your home for essential services. This is for food, medicine, and if you're sick, and you call your doctor first, so that they will tell you whether to come in or not. As I stated in our previous conferences, we really are feeling the impact of COVID-19 here in Black Hawk County. The surge has been here. It's still here. It's our cases are continuing to increase. I'm not seeing these numbers are not going down. They're increasing, and so this is very serious. I want everybody to do their best to stay at home. I know that it's getting sunny. The weather is beautiful, but please stay at home. And if you are doing activities that require you to be outside, be with your immediate family. Be with only the people that you live in the household with. And so this is an urgent request. I ask everybody to do their parts as much as possible. So with that said, this is all that I have at the moment. I know that there's been talks about Tyson, the health department, at the state level is working with logistics, with the logistics in terms of testing of Tyson staff and employees. And so right now, this is what they're working on, and they've communicated that with me. So again, community, we are in a very, very difficult time with COVID-19. I ask you all to please stay at home. Please practice social distancing. Please wear your face mask so that you contribute to not only saving your life, but saving the lives of others. Thank you.
Thank you. Our next speaker will be Dr. Jane Lindaman from Waterloo Community Schools.
Hello, good afternoon. Thank you for another opportunity to update the community about Waterloo Schools and our continued role in trying to support our students, our staff, and our families during the extended COVID-19 shutdown. Now that Governor Reynolds closed Iowa schools for the remainder of the school year, we are working harder than ever to stay connected to students and families through continuous learning from home. The learning continues online for our 2nd through 12th graders, and instructional paper packets are being distributed at our grab-and-go sites for our preschool students through 1st graders, and then as well as any 2nd through 12th graders who do not yet have online access. If you and your family need help getting connected to online learning, please call your child's school office and leave a voicemail. Office staff are calling families to help them get reliable internet connections, and Chromebooks are being provided by our districts so we can bridge the digital divide. Some 1,700 Waterloo Schools employees continue to support our students and their families in multiple ways. Teachers are creating lessons for all of their students and sharing them through video instruction, online assignments, and through packets handed out at our meal sites. A few weeks ago, the governor laid out plans for districts to provide continuous learning. I mentioned at an earlier press briefing that Waterloo Schools has been approved for something called voluntary continuous learning. Because of the word voluntary, there can be some confusion about what that means. We are working to provide clarity, and actually just before I came here, I recorded a video that's going to be sent to our families tomorrow, which should provide some additional insight and clarity. The label voluntary is the state's term, and it can be misleading, sort of like take or leave it. While we are not providing grades at this time, participation is very much expected. Teaching is expected, and learning is expected. We are very much open for business. Our learning plan has 5 major components, and I'll list those right now. Number 1, lessons and instruction. Number 2, assignments and opportunities for students to practice that work at home. Number 3, interactions with teachers, either online through Google Classrooms or email or phone. Number 4, feedback on their work, on the student work. And then number 5, our voluntary plan includes non-instructional supports. This is very, very new, and we want to help our parents, our students, and our caretakers better understand the process involved in voluntary continuous learning. While we expect students to participate, we also know this is a very difficult time for many. Please just do the best you can, doing as much as you can, and continue to communicate with your child's teacher and the rest of the staff. We continue to provide meals for our students, with thousands of sack lunches being handed out at all of our grab-and-go meal sites weekly. We run our curbside grab-and-go on Mondays, Wednesdays, and Fridays, still providing food for all of the days of the week. So the way that works is on Mondays, students get meals for Mondays and Tuesdays, and then on Wednesdays, you can get meals for Wednesdays and Thursdays, and then on Friday, you can come in and get the meal for that day. While our main focus is to support students right now, we are also beginning to plan for life after the shutdown. And believe it or not, it is there. Life after the shutdown is there. Since we are still unsure of the timeline and what restrictions that may look like into the summer months, Waterloo Schools will consider changes to summer school, next year's school calendar based on the governor's guidance, and start date restrictions are being waived, so we're looking at that. While we have not yet confirmed our plans, I can assure you that we will work hard to maximize instructional time in our next school year. We so appreciate all of the employees who are working from home to support students and families in very unique and creative ways. And I would urge people to drive you to our social media sites, Facebook or Twitter, just to see some of the things that are going on. It's really heartwarming. We know that they miss seeing the smiling faces of the nearly 11,000 students in our district. And very importantly, if you have general questions, please call our shutdown hotline, which is 319-433-2020, or go to our website, waterlooschools.org, where details about our continuous learning plan are being populated. Grab-and-go meal sites and other information can be found there as well by clicking on the red banner at the top of the homepage. Please know we are all in this together, and we will continue to do whatever we can to support our community and see this through. Stay with us. We're going to get it.
Okay. Our next speaker is Dr. Anthony Voss, Superintendent, Hudson Community School District.
Good afternoon, everybody. Thank you, Lorie. I would like to start this afternoon again by first praising everyone who's been involved in this emergency effort, from our healthcare workers, grocery store employees, and all other essential employees across all sectors of our county and state who are working hard to keep everyone healthy and safe. A lot has changed since I last spoke with you, the most significant development being that our schools will remain closed for the remainder of the current school year. This has been a very big week for us if we have come to grips with the fact that the 2019-2020 school year is going to end without us being with our students. But at the same time, we need to remember this school year has not yet concluded and that we still have important work to do. I am sad and disappointed, however, in the way that our school year will end. Our inability to bring closure to our time together this spring breaks all our hearts. We're missing our friends, our colleagues, and some of us are even missing family members. Regardless, our focus continues to be on the students we serve in our district. Our teachers and our entire staff are working hard to make life as normal and stress-free for all the children in our district. With that, our meal service continues in the district and is available on Mondays and Thursdays from 11 to 11:30 at both Country Terrace and behind the elementary school. You can still sign up by visiting our website, and families do not need to commit to this every single day. This is a service. It's a service for you, and it's available to any child in the district age 18 and under. At this point, over 10,000 meals have been served since this program began in mid-March. We will continue to offer voluntary educational opportunities for our students and have no plans at this time to move to a required model. I appreciate the comments of Dr. Lindaman and what she said about that, so I won't go into all of those details again. However, I say make no mistake, we all realize that once our doors reopen, we will have our work cut out for us. A gap will exist, and it is our intention to close that gap as rapidly for our students. And preliminary modeling does suggest the gap will be significant. However, our plan will be more than aspirational and rooted in the idea that we can close that gap within one academic year. But we cannot achieve that goal without all of you. This is a time where we hope to encourage parents to become active partners with the teachers to help ensure learning continues. The teachers are working very, very hard to do their part. But how big our gap is dependent on how engaged we all are as we work to close out this academic year. To help us prepare for the reopening of school in August, we will be developing a Return to Learn plan in coordination with the Iowa Department of Education. It is our hope this plan will blunt the learning that is missed, providing remediation to our students, vertical curriculum articulation and planning amongst the faculty, and collaboration with our families. While this plan is currently in development, the Hudson Board of Directors have requested me to provide them with a workable framework in time for our May board meeting so we can furnish as much lead time as possible to our community regarding our plans to reopen. District officials have begun to field requests for access to our buildings so students can retrieve their personal items from their lockers and classrooms. This is certainly understandable and no doubt important to everyone since we now know our buildings will not reopen this year. However, due to the extra safety measures for this region of the state, we're going to hold off on the majority of those visits until some of these restrictions begin to be lifted. We anticipate and hope this will be sometime around the middle of May. You can expect a coordinated and choreographed procedure for obtaining access. When the time comes, we will do everything we can to ensure that your visit can be quick and strategic. While we can now acknowledge the fact that activities planned for our students this spring are now canceled, I have been impressed and proud of the way our entire community has responded. Most of all, though, I feel great empathy for this year's graduating class. This isn't the ending they or their parents envisioned. As they have reached the pinnacle of their career as a Hudson Pirate, the moment they have worked so hard for is being taken away. I feel terrible that I can't fix this for them. But they are a strong and resilient group of young adults. This morning, I had the pleasure of participating in a meeting with our senior class hosted by the high school principal and the 712 counselor. The Hudson High School class of 2020 has given me great hope. The strength and grace which they are handling this adversity proves to me that our future as a society is very bright. While we will be unable to celebrate their achievements in person, we are making plans for a virtual and pre-recorded ceremony on May 17th, which is the original date of commencement. We are also hopeful we can host a face-to-face celebration later on this summer if the conditions warrant. And finally, I want you all to know that you are in my thoughts every single day. During these uncertain times, some of the bright spots for me are when I hear from a student, parents, or staff members that they have learned a new skill, had a positive interaction with their teacher or student, or are just doing all right. I miss you and can't wait to see you again. Stay strong, stay safe, and please stay home. Thank you.
Our next speaker is Amanda Goodman of the Family and Children's Council of Black Hawk County, Executive Director.
Thank you. I want to get right to it. We are concerned that this pandemic is leading to a child abuse epidemic. Sadly, Black Hawk County already ranks in the state as one of the highest when it comes to reported child abuse cases. Teachers, guidance counselors, daycare providers, they were all typically serving as the lifelines for children who are vulnerable or at risk. For many kids, school is their safe place, and now, as we know, this has been ripped away from them. And they could be stuck now in these unsafe conditions for months. We often see a surge of child abuse cases. We're talking emotional, physical, and sexual in the fall because the abuse that happens during the summer goes undetected. We should be expecting a much larger surge now. 90% of the children in our community and nationwide who are abused, they know their predator. We can also expect there to be a new group of at-risk children who before COVID-19 had a pretty normal home life, but take financial stress, worries about the future, unable to pay bills, losing a job. Now it is a pressure cooker situation for everyone in that entire family, that entire household, and parents can snap in that one moment and the child is on that receiving end. So let's talk about your own home right now. For parents, it is important, very important to recharge your batteries. You are tasked with a tremendous amount right now, working from home, homeschooling. I completely understand. Our parent education coordinator at Family and Children's Council recommends you pick and choose your battles. Not every behavior needs a response from you. She recommends using redirection, distraction, and simply ignoring some outbursts. You want to utilize tools such as a timeout, some quiet time. You want to recognize with your children that this is the new normal, and it's okay to let things slide. Parents, we make mistakes as well. We get frustrated. We lose our patience. We want to model that that is okay and how to apologize when it's necessary. And we want to be alert for signs of stress from your kids, outbursts, yelling, crying. Get down eye level and respond with love. Now let's talk community-wide. We all need to be the nosy neighbor. Everyone needs to be the nosy neighbor. We need to go back like it's back in the old school days. This is how we are going to protect every child. We're asking that you follow your gut if something doesn't feel right. Now that the weather is warming up, children should be outside in their own yards playing. So you want to look out your windows to see if you haven't seen a child outside from a particular house. If they are, do they appear withdrawn? If you yell hello from across the street, do they wave back or do they put their head down? If they're younger, are they spending too much time outside by themselves with zero adult supervision? These are all signs of potential child abuse happening in a home. It's also important to remember that social distancing does not mean emotional distancing. We need to use technology to do virtual check-ins. I'm asking the schools, they've been great so far, and the teachers, when you meet with your kids via Zoom, we're asking that you pay extra attention to a student's eye contact, their level of eye contact, maybe create a thumbs down system where they can relay a message to you without saying anything. Teachers, guidance counselors, administrators, if we're not calling the homes of the students, again, this is up to each individual district, but we're asking that we talk to parents weekly and then ask to talk to the child and ask the student, are you happy? Are you getting enough to eat? Do you feel safe? This way, these teachers and counselors and administrators, these kids are missing this. These are their lifelines, and they need them in their lives. FCC is the Child Abuse Prevention Agency here. While we're not working at the physical office, we're still working remotely. We're working day in and day out. Make no mistake, child abuse prevention in Black Hawk County is a critical need. So when you hear people talking about critical needs, this is a critical need. FCC has Instagram and Snapchat accounts set up so children who have access to social media can reach out to us directly if they don't feel safe. We can be their safe zone. Our Take Charge of Your Body sexual abuse prevention videos, the presentations, we have them on video. We have shared them with all of the schools. This talks to the children about what's appropriate behavior, what's not. They're also available online on YouTube. Our parent education coordinator is available for anyone who needs some help during this stressful time. Again, I want to end by stressing this again. Please be the nosy neighbor. It sounds cliche, but we need to bring back the village now more than ever. At the end of the day, it is our responsibility as adults to protect every child in our community. Thank you.
Thank you all. That concludes this part of the press conference, and we will open it up for any questions.
Yes.
I had a question about the current PPE levels that are coming in.
The PPE level right now is good. We have supplied almost all of our nursing homes, our 2 hospitals. We have done some doctor's offices, our long-term care facilities, and also some group homes. We are reaching out currently tomorrow for our EMS services and helping them, and anticipate doing a PPE request to the state next week.
You mentioned 2 hospitals. There's 3 major ones, I guess, People's, Mercy One, and Unity Point. Which 2 are you talking about to supply?
Well, the clinic is People's. They don't have a hospital. And then Mercy One and Unity Point, they're all 3 being assisted.
We have a question from Mary Green at KCRG. Mary Green, you can go ahead.
Hi, my question is for Nafissa. Can you all hear me?
Yes.
Okay, perfect. Nafissa, do you have an update on how many of the cases are linked to the Tyson outbreak? And then second part of that, on Monday you mentioned that there was a little bit of a backlog with that contact tracing. Could you just kind of explain some of the challenges that you all are facing that have contributed to that?
Repeat the question for people.
Okay, so the first question is in terms of the case numbers for Tyson as it relates to the total caseload for us. And the second question is the barriers or the completions of the contact tracing. Okay, so in terms of the case number for Tyson, we don't have that, but we do know that it's over 90% of our cases are linked to Tyson. So that's one. The second thing is we actually made some great successes in terms of the contact tracing because the Iowa Department of Public Health is also taking a huge load in terms of assisting us in regards to the contact tracing.
And then we have a question from Shannon Moody. Dr. Nafissa, can you update how many Tyson Waterloo employees have been tested so far and how many positive cases are linked to the plant?
I don't have that number.
I have a question for Jane Lindaman. I wanted to know how many students still did not have internet access, whether a hard number or a percentage or an estimate.
Sure. The question was what number or what percentage of our students do not have technology access. So we've been attacking that in two stages. First of all, we put out a survey. Parents who are, if you had a child in Waterloo schools, you got the survey, I think 7 days in a row, so a lot of them. From that survey, we had about 5,000 people respond. And for them, most of them had technology, as you would expect. So of them, I think we ended up with about 300 or 400 that we needed to call from the people who responded. But as you know, we have 11,000 students. So we actually are in the process now of working through everyone. We will have all of those numbers by tomorrow. My hunch is that we are probably around, I would guess 30%. Right now, 30% of our students do not have access yet. We actually are able to serve them if the families will call. So in my statement, I really urged people to call. So it takes just a little while, but we can set it up. We can make sure that they have a device if they don't have one. And by device, I mean a laptop or a Chromebook. So we can get them that, and then we can get them hooked up. Right now, it's taking a couple weeks to get that done. But since we're in this for the long haul, it's definitely worthy of making those phone calls. I urge them again to call their child's school, leave a message on the voicemail, and we will call them back and get the process started.
Okay. We have a question from Kate Payne, Iowa Public Radio, for Dr. Nafissa. You mentioned the Tyson testing, but can you give us more details on the logistics for Tyson workers being tested, and how many confirmed cases do you expect as those results come in?
So in talking to the Iowa Department of Public Health, they're still working out the logistics in terms of how this is going to be conducted. So I don't have any additional information on that. What I do know is that the state is going to be doing the testing. So there was communication out that came from Tyson also indicating that the testing would happen Friday and Saturday. However, I have not received confirmation from the state that's what the plan is. So I'm still waiting to hear from the Iowa Department of Public Health.
And can you say how Blackhawk County defines the surge, and how will we know when it's over?
At this moment, so one of the things in terms of defining the surge, you see the increase in cases that are occurring. And so just a few weeks ago, how we were at 21 and all of a sudden we doubled in our caseload. So that's in letting us know that first of all, community spread had already occurred, but the increase in volume is what is indicative of this surge. The second question was?
Well, how will we know when it's over?
Oh, so when you look at studies that have been published and what they define is when you start seeing a decrease in the numbers, a consistent decrease in numbers. And so right now, that's not the case for us.
And from KWWL, Marshall County is at 239 cases, and there is a JBS meatpacking facility there. Is Blackhawk County in communication with Marshall County about how to prevent a spike there, as we have seen in the Tyson plant?
That would be the responsibility of the Iowa Department of Public Health. But we work with our county partners in terms of communication. Any guidance that we can provide, we do that. But most of the communications in terms of the preventative measures and what to implement within those specific counties and facilities, it comes from the Iowa Department of Public Health directly to them.
I wanted to ask about hospital staffing issues. We've heard from some of the hospitals that they're really seeing this surge as you're describing. Are there any resources that you have coming from the Iowa Department of Public Health, for example, to increase staffing there or help them take on some of that workload from the surge?
For the hospitals and local public health, we've been in constant communication. I was actually talking to them before this meeting. They haven't indicated that they don't have the capacity in terms of serving the community. In actuality, it's been more on the logistics and the coordination to serve the community and also the resources for testing. And so those are the conversations that we've had, but we've never they've never indicated an issue in terms of staffing.
Also, I've been hearing about the tests that are coming from the state being slightly flimsy. Have you heard about this at all?
No, not at all. No.
Oh, I'm sorry, one more question. From Iowa Public Radio, in regards to the surge again, do Black Hawk County hospitals, clinics, emergency responders have the capacity to handle the surge?
At the moment, that's what they've communicated, but I would ask them the next press conference, but that's what they have communicated to us. Mm-hmm. They're ready. They're prepared. We're prepared. We are. I just think it's a matter of more logistics, and we're all in this together to serve the community. And I know Tyson, the employees, roughly there are about 2,700 employees, and so just making sure that coordination happens is going to be critical.
Question from KWWL. Has the Black Hawk County Health Department talked with the union representing meatpacking workers at Tyson? If so, what are they saying about the condition inside prior to the announced shutdown?
No, we have not been in communication with the union at Tyson.
Have you been in communication with Tyson management at all in terms of a timeline for reopening?
We've been in communication, but it hasn't been about reopening. It's more about testing and making sure that the employees are tested. And you know, my biggest concern has been about what are the next steps to ensure safety of the employees. Mm-hmm.
What are those next steps?
So looking at testing, looking at disinfecting the facility. So what are those protocols set in place? And also, with this new virus, we don't know how long individuals are immune. So everything that we're learning is relatively new, and we just have to figure out how do we continue to make sure that everybody's safe, regardless of whether it's just Tyson, but in the community.
All right. If there are no more questions, this will conclude the press conference for today, April 23rd.
Sorry, we do have one more question.
Okay.
From KCRG, Nafissa, with the rising number of cases in Black Hawk County, have you all had any indication from the state that one of the Iowa testing sites could be coming to Black Hawk County soon?
Okay, I can answer that. The Test Iowa site is being coordinated with the Iowa National Guard, the Iowa Highway Patrol, the Department of Transportation, Emergency Management, the Waterloo Police Department, and the Black Hawk County Sheriff's Office. We are looking at getting a Test Iowa site in Waterloo, and that site should be here early next week and be ready to go for operations. Okay, thank you everyone.